much is Chris Whitty to blame, and Sir Patrick Vallance, for the amount of excess deaths that we're seeing now?
Probably very little. I don't think the blame can be laid at their door. The reason why the NHS is overwhelmed is something to do with the pandemic, but not a huge amount. This was a disaster waiting to happen for the last 20 years. And the workforce crisis is the way it is now in the health service, and you're not going to change very much of that, whether you have a lockdown or not. The reason for the lockdown at the beginning was we didn't have vaccines. Once vaccines appear and other treatments, then lockdowns are pointless. But certainly...
Yeah. Well, just to interject on that, one of the things that really stood out for me on this was the amount of people who didn't seek medical attention kind of when they thought they were ill. And I can't escape the idea for me that that is down to some of the fear-mongering that we saw. We know now that a lot of Chris Whitty's models were not accurate. And, OK, we were in a crisis, but still, they were presented as fact a lot of the time. Whether or not he wanted them to be, they were taken as read by a lot of people. And a lot of people did not seek medical attention as a result of that. And now we're paying the price for it, are we not?
I think that's a very simplistic interpretation of what Chris Whitty said and did. He added caveats to absolutely everything. Everything he said was hedged with, I don't know, I'm not sure, we can't be certain. And I'm sure he was right. You can't be certain. We knew that if people didn't present early enough to the health service, excess deaths would rise. That was obvious. What wasn't obvious to many people was how badly other factors would impact on catching up after the pandemic. Inevitably, if you aren't open, or people think you're not open, then you will not be able to deliver healthcare to the right number of people.
And
that was inevitable.
Whose fault is that then? Because I'm looking here at some figures where we're seeing hundreds of cancer patients, excess deaths every single month. We're seeing hundreds when it comes to heart conditions, diabetes, child mental health. I did a report yesterday about a quarter of children who grew up during the lockdowns now suffering from mental health problems. We've got a backlog of 7.1 million patients. And then I'm reporting on stories about GPs wanting to work 9 to 5.
Yeah, so I'm not sure where the GPs working 9 to 5 comes from. Sounds wonderful, but I can't imagine ever working those kind of hours.
They're voting for it, apparently. They're voting on their practices being open 9 to 5.
I'm aware of that, but you and I know that you couldn't possibly run a GP business 9 to 5 and earn a living because the health service wouldn't let you do that. Anyway, that's a separate issue. The question you asked is why are there excess deaths? And the answer is because the catch-up, which was inevitably going to be part of the recovery phase, however long the lockdown was for, whether a Chinese-type lockdown or no lockdown at all like Sweden. At the end of it, you have to catch up all the people who, for whatever reason, didn't present and weren't seen. And that catch-up requires a workforce that isn't there now.
I've just got to say, I think that the reason people didn't go and present is blindingly obvious. You had Chris Whitty's slides of doom pumped into your living room every single day. I remember watching them, sat next to my elderly grandma. She won't thank me for saying that. I watched that once because we had one of these emergency broadcasts. I was sat next to her. She was utterly terrified. You play that out across the course of the nation, and I'm sorry, you get people not seeking medical help for things.